The warming of the climate could affect health in a number of different ways. First of all, by affecting the amount and the quality of the food that is available, water that is available, through heat stress on the one hand, but also reduced cold stress, not getting as cold in the winter, but hotter in the summer. And through the spread of what are called vector-borne diseases, that is, diseases that are carried by things like mosquitoes.
The projections for Ontario are that by 2020 we'll have the climate of Ohio, and by 2050 we'll have the climate of Kentucky. What we know about climate change is that 2 to 3 degree average global temperature change equates to more like a 4 to 6 degree temperature change in southern Ontario, and something more like 12 degree temperature change in the northern Ontario, North Quebec. And that, of course, is huge for people who are living in northern climates.
The average temperature in the city is going to go up about 4.4 degrees. So knowing that we already have a pretty significant burden of illness, so we know there's already people dying because of extreme heat in the city, and then we know that we're just going to have more hot weather, I would say that's probably one of the biggest concerns. There are other concerns as well. So air quality is one. Actually, air quality in Toronto over the past 10 years has been overall improving, but with climate change, we're expecting to see higher levels of ozone because of the weather conditions it will have, and that could actually counteract some of the improvements that we've seen over the past years.
The impacts of more extreme weather in terms of flooding, droughts, like ice storms and so forth.
Basements fill up with water, so there's a whole bunch of things that can happen there. Once the water's gone, they can get moldy. So anybody who's got a respiratory condition or, an allergy situation, if you get mold developing, it's really not good for your health.
A small amount of warming in some regions could increase food production, but there are parts of the world where we're already pretty close to the optimal conditions for growing food, and so warming will decrease food production. Humans, farmers, can adapt to some point, but by the time we're up to 2 and certainly by 3 degrees global average warming, and we're almost at 1 degree now, we could see reductions in the amount of food produced by 20%, even 30% in some regions.
In Toronto, we have something like 3 days worth of food available to us in the city at any given time. If we had an extreme weather event that cut off distribution of food to the city, that might be a problem. We also rely a lot on imported foods, and climate change has impacts on other parts of the world where some of the crops are grown that we rely on. So again, that's one that we don't have a really good understanding of yet, but we do know that it's a problem.
What has been found is, although there's more plant bulk, the actual concentration of essential nutrients goes down in a higher CO2 world. So even if we manage to maintain the same bulk food production, it very likely will be of lower nutritional quality. Most people don't eat food of very good quality, and so even today we should be shifting towards higher quality food. We may have to do that even more so just to compensate for the effects of the higher CO2. The same thing goes for water. Areas of the world that are already dry and that are already subject to water stress, like the entire Middle East, North Africa, parts of China, they're projected to have even less water. Water is important for human well-being and human health. It's also needed for growing food, and sanitation systems require clean water. The poor people in poor countries especially have had the least to do with causing the problem. And of course, poor countries also tend to be the hotter countries to begin with. So we're already approaching the physiological limits of human tolerance for heat in many of these countries.
When we look internationally, we see also that, in fact, the people most responsible for climate change, that's primarily us in North America, are the least exposed internationally to the impacts. There's no question that as temperatures rise, that's affecting ground level air pollution because the heat holds those more closer to the ground and we get these smog days. Particular concern here in southern Ontario, where we have a lot of automobile traffic and transportation.
It's bad news. And it's not, in this case, just the change in climate. It's the fact that we're also acidifying the oceans, because most of the carbon dioxide that we emit into the atmosphere will eventually be absorbed by the oceans. 55 million years ago, over a period of 10,000 years, an amount of CO2 comparable to what humans may be emitting in the next 100 years. We see when that happened, there was massive extinction of species.
We know the oceans are warming and that they so far have absorbed a lot of the carbon, the excess carbon that we've been producing. It's changing the coral infrastructure and its capacity to support diversity of life within the ocean. There are, of course, many other things that are also affecting ocean populations, including overfishing, the amounts of plastic that are turning up in the oceans. We're seeing a collapsing of fish populations in many parts of the world, and millions of people rely on those as their main food source. Ontario Medical Association has produced some data showing really the correlation between heavier smog days, air pollution, and various kinds of illnesses and deaths as well, and hospitalizations. So we're pretty certain that that will increase with climate change.
We are not doing very much in ways of prevention. Take, for example, these glass condominiums that are going up in Toronto. And they're absolutely the last place you would want to live as the climate gets warmer, because they are completely dependent on non-renewable sources of energy to remain habitable. If the electricity supply system fails for any reason on a hot day, these buildings are uninhabitable.
Even if we can get our greenhouse gas emissions under control, we have to recognize that climate change is happening and that it's going to continue on a certain path for a number of years. So we need to be prepared for it, and we need to kind of plan for it and be ready and know how to cope with it.
The most important thing we need to do is limit future warming, and we need to do that by limiting emissions of greenhouse gases, some of which are from energy, from fossil fuels. So we need to use energy as efficiently, as sparingly as possible, so that we need as little of it as possible. We shrink the energy demand pie down, and then we need to carve up that pie entirely with renewable energy.
We know that we need to reduce, in fact, our carbon footprint by about 80% within the next couple of decades. And that sounds like a huge task, given how society is organized, but as someone who's reduced mine by 60 or 70% in the space of 2 years, I know that it's possible.
Identifying who are the vulnerable people, what is the best action that we can take in terms of preventing impacts.
The single biggest thing that we can do is to eat less meat. That means less land, less deforestation, less methane, less nitrous oxide. The whole food production system can be scaled down. By eating less meat, better still going vegetarian, or of course the vegan diet has absolutely the lowest impact on climate of all the possible diets. And there's a lot of evidence that it's actually the best diet for your health.